Sí, doctor.
Okay. So remember that we always, I'm going to always put some questions that can be on the exam. Okay, so you can try to do them if you want. So about the skeletal system, you know that the main function of the skeletal system is to act as a framework for the body, and it supports and protects the internal organs. Also, in conjunction with muscles, like you've seen in the video in practice, it's going to help with locomotion or body movement. And another main function of the skeletal system is the formation of blood cells in the bone marrow. Yeah, the red blood cells in the bone marrow by hematopoiesis, and this is takes place especially in the spongy bone. Then you guys remember all the different skeleton, the bones that are in the body. You know this better than I do. I haven't done anatomy since the university, so you guys know this better. Let's see, who can tell me in Spanish what ulna is? Someone wants to tell me? A ver, Nicole, do you know what ulna is? Sorry. This one. Nicole, Warfaya. Okay, so someone else. Let's see, Alison. Do you know what ulna is in Spanish? If this is radius, what is ulna?
Cubito.
Muy bien. Okay. And who can tell me what, let's see, Liz Cutimbo, tell me what fibula is in Spanish?
Miss, could you repeat the question, please?
Can you tell me in Spanish what fibula is? This one, the one that I'm circling.
Perone.
Perone, muy bien. Okay, and okay, so let's talk about the rib cage. So do you remember the difference between true ribs, false ribs, and floating ribs? Can someone tell me? Let's see.
True ribs are united to the sternum, and false ribs are not.
Very good, Manuel. Muy bien. Okay, and let's see what else. This question was in the exam. Remember the parts of the appendicular body that are the extremities, and then of the axial body you have the skull, the thoracic cavity, and the spinal column. Then we can talk about the bone classification. You have the flat bones like the sternum, the cranial bones, then the long bones, irregular bones, short bones, and sesamoid. You don't have to know all this, just maybe the classification if you want. And some anatomical landmarks of the long bones. For example, diaphysis is the shaft of the long bone, so this. The epiphysis here. Remember what is, alguien tiene que apagar su micrófono. Okay. So then we can talk about the metaphyses that includes the growth plate. For example, for me, it's important to see the growth plate because it can tell me the bone age and how the child is going to grow. So, for example, in girls, the complete fusion, so when the growth stops is between, it's usually at 16 years after menses, and in men, or sorry, in boys, it's until 18 years, 18, 19 years when the growth can stop. With a bone age, for example, you can know how when the kid is going to start developing. It's important, interesting. Okay, so about the muscular system and the video you were see, remember there was I think you guys were talking about the skeletal muscle. Remember that the skeletal muscle is part it's responsible, sorry, for the voluntary movement. Cardiac muscle and smooth muscle, that is the visceral muscle, this operates involuntarily. And the different types of muscles that you guys remember more than I do. And then the muscle motions. So you have abduction and adduction. Do you know the difference? Can someone tell me? Let's see, Angie Sofia Valdivia. Do you know what abduction is? Would be? No?
Is
when what?
When you separate the extremity your body.
Okay, very good. So when you move away from the midline, from the body, and up with AD, when you move it toward the midline, okay? Then supination and pronation, for example, when you turn the palm of the hand upwards, that would be supination, or when you're in a supine position, you're laying on your back, and in a prone position, I think that was also part of the exam. So when you're laying on your back, what is it called? How prone position or supination? Who can tell me? Daniela Belén. When the patient is laying on his back, would be a supine position or a prone position?
It would be a supine position.
Okay, very good. And on his belly, on his abdomen, that would be on his front, that would be a prone position. And with your feet, you can do dorsiflexion and plantar flexion. Dorsiflexion with the foot, bend the foot upward to the ankle, and plantar flexion when it bends it downward. Then you can talk about the joints. You have two different types, ball and socket. That this is very typical, for example, in the hip, and hinge joint that is typical in the knee. The difference between these is that the movement, the range of the movement. Ball and socket, you have multiple directions, and hinge joints, usually it's only like extension and flexion. Sorry. Okay, here. See, hip joint, you have different types of movement, and not only extension and flexion, but also abduction, adduction, lateral and medial rotation. These are some pathologies related to hip joint abnormalities. For example, congenital dislocation, when there is a dysplasia of the hip and there's a limited abduction of the hip. And the most common something that you see very commonly is this limb length discrepancy. This is why they limp. And the treatment for this is the harness when they're babies. And then in acquired dislocation, this is a complication of a total hip replacement, and the treatment in this case would be surgery. Okay, so this is a harness that you put in babies. And a knee joint, the movement is a little limited. It would be extension and flexion, basically. And that's it. So here we talk also about the joints. Clinical relevance would be a meniscus tear that is very common in a sport injury. Symptoms here would be pain, stiffness, swelling, and joint effusion. What do you think joint effusion is? We've talked about effusion, I think, before. Daniela Isabel. We talked about pleural effusion, pericardial effusion. What would be joint effusion? Daniela.
Doctor, sorry, my internet is a little bit bad, and I didn't hear it very well. Please,
Okay,
can you
so,
repeat?
yes, what do you think joint effusion means?
Como una oclusión.
No. We talked about joint effusion, for example, we talked about pleural effusion, ¿no? Que es un derrame pleural. Then we talked about pleural effusion, que es un derrame pericárdico. So what would be joint effusion?
Un derrame.
Ajá.
Un derrame del líquido entre las sinovial.
Sinovial. Muy bien. Okay, so that's joint effusion. And that causes swelling. Okay. Here, the diagnostic test is clinical because you see the swelling. In Spanish, for example, I think it's called, I don't remember. Wait. Como, signo del témpano. I think that's in Spanish. And also the diagnostic tool would be an MRI. Okay. The treatment for this, for meniscus tear, depending on the severity and the degree, it could be RICE. RICE is rest, ice, compression, I think it's like that, and elevation, like that. Sorry, elevation, and compression. I think it's like this. Okay, that's the treatment. And then we can talk about fractures. Okay, so in fractures you have partial fractures or a complete, a partial or a complete break of the bone. And it has different classifications. For example, open and simple, when it's visible through skin, or closed or compound when the skin is intact. You have linear fractures, comminuted fractures, this would be a comminuted fracture. See all the little parts. Segmental fracture like this. And green stick fracture, this is typical in children. Other types of fractures would be pathological fractures that are typical of osteoporosis, and stress fracture that is usually caused by overuse. For example, this would be also a sports injury. Here, the clinical approach, the symptoms related to the fracture are pain, swelling, deformity, and inability to use the affected parts. So if you have a femur fracture, do you think you could walk or not? Let's see, who can tell me? Esperanza Irene. If you have a femur fracture, do you think you can walk?
Um,
I don't think so. No? So, who can tell me what tenderness is? Let's see, Adriana Giovanna. Do you know what tenderness is? No, someone.
Dr. Tenderness means sensibility.
Okay, very good. Okay, so there would be an increased sensibility, like pain, abnormal movement, and crepitus. And the complications can be related to the fracture itself. So the inability to move, that would be a complication, but also there can be vascular and neurological damage like pain, pallor, paresthesias, and pulselessness. So what does pulselessness mean? Who can tell me? Ana Paula? Inés?
Yes, I think that is like pulsaciones.
Pero sí, más o menos. So if you pulse would be pulsaciones, ¿no? And would be pulselessness. ¿Hay pulsaciones? No hay pulsaciones.
No, no hay pulsaciones.
No hay pulsaciones. Okay. Okay. So no se siente el pulso. Very good. And do you know what paresthesia means? Who can tell me? Let's see, Brenda Brigitte.
It's like when you feel like a little hormigueo, something
Okay,
like that.
tingling, no? Or like numbness also. So patients can say that because paresthesia would be a medical term, ¿no? Entonces, parestesia es un término médico que no, los pacientes no te dirían eso, pero sí, como dice Brenda, pues como un hormigueo, ¿no? O como calambres, o como medio, o sea, con poca sensibilidad. That's numbness or tingling. Very good. And what is pallor? Ximena. What is this? Ximena Candida Flores. No? This would be pale, palidez. So for the diagnosis, you need a X-ray with 2 views, and the treatment the object of the treatment is going to be the reduction or the attempt realignment of the bone involved in the fracture or joint dislocation. And this alignment can be, or this reduction can be closed when it doesn't need surgery and open when it needs surgery. For an open reduction, you need wire, nails, plates, prosthetics. And when you use this, we talk about a total replacement of the particular bone. And finally, we can talk about some vocabulary. So orthopedic surgeon, he's the physician who specializes on the diagnosis, treatment of disorders involving the bone, joints, and muscles. Then we have X-rays, radiographs that we talked about before. Then arthroscopy is a visual examination to see the internal structure of the joint. And you use this an arthroscope. Then ankylosis is the loss of or absence of mobility of a joint. This can be like a disease, an injury, or it can be done surgically. When it's done surgically, it's called arthrocentesis. Then costochondritis, this is an inflammation of the cartilage that connects to the rib. So sometimes this can cause chest pain and can be confused with a heart attack, for example. Arthritis is an inflammatory condition of one or more joints. The diseases related to this. Arthrosis would be when there's blood within the joint. This can cause, for example, the joint effusion. Atrophy means weakness or wearing away of the body and tissue and structures. Atrophy of the muscles can be caused by any pathology or by the disuse of the muscle for a long period of time. And sarcopenia, this is a degenerative disease that usually happens with age, for example, more than 65 years. Luxation is the displacement of the bone from the joint, and sprain is a stretch or a tear of a ligament. And that's it. Okay. So you just have to know some of the vocabulary, okay? And we can talk about the clinical, and we can talk about the clinical relevance, of fractures and hip joints for the exam. I think nothing else. That's it. Y esta es nuestra teoría. Do you have any questions? ¿No? ¿Preguntas?
Doctor,
Sí.
the costochondritis can be cured with rehabilitation or not?
For costochondritis, you usually give NSAIDs, anti-inflammatory drugs. Sometimes it can be caused by an inflammation or by the misuse of when you're, for example, when you're not used to doing exercise and then you start doing exercise, you sometimes can cause an inflammation of your of these articulations, and you can have this costochondritis. But you just have to you can do some rehabilitation, but usually just take some anti-inflammatory pills and it's better. Very good, Carolina. Someone else? Another question? No? Okay. So, en media hora, en una hora les pongo también ya la práctica para la siguiente semana. Les vuelvo a repetir, no tienen que preparar nada, solamente en clase leemos. Va a ser un artículo a ver, va a ser este, no sé si lo van a ver. Van Buchen se llama, que es un caso un poco raro donde no hay una buena resolución ósea. Ya está chicos. Si alguien tiene una pregunta, pues me puede escribir por el team, en los mensajitos, y nada más. Ya nos vemos la siguiente clase y luego me quedo 15 minutos late y ya comenzamos entonces